All right, good morning, everybody, and welcome back. You are in for a treat with our first lecture. Is Dr. Len Brancewinz. He is not only an amazing healthcare professional, but one of the nicest people I know and one of my great friends. So we're very excited because he's going to be presenting how to stay healthy on and off the course, which, Len, I know that your life is now golf. Every time I call him, he's like, hey, I'm on the course. I'll call you back. So this is a real thing, though. I'm sure you're seeing that there's a lot of joint health issues anyway in our society. But then when you try to enjoy something, it really detracts from it. So this should be a very interesting lecture on joint health and golfing.
Yeah, and I have my mug that I have my coffee in. If you can see this, it says the U.S. Open, Oakmont, Pennsylvania.
Okay.
From the last time the U.S. Open was in Pittsburgh. So let me just open by saying this. I just got done watching because it started at 2 o'clock in the morning, and I ended up coming back from my Atlanta office driving all night. So I got to listen to this during the whole night, listening to a young fella, Colin Morikawa, who's 5'7", 5'8", about 140, 150 pounds, outperform all of the muscle guys. And this is a fella that when they interviewed him, said his first and foremost, he's only 23, 24 years old, that ever since about age 6 or 7, he has worked on his joint health. He said it. He said, if I can keep my joints flexible, I can hit the ball as long and as far and as accurate as the big dudes, the big bulky fellas. And he ended up winning the U.S. Open or the British Open yesterday. So he who practiced good eating, he brings a dietitian with him when he's on the road. He brings a flexibility coach with him while he's on the road. And at age 24, he now tops the scale of winning 2 majors this year. So I'm jealous. I didn't take up golf until I was 40. And I practice 3 or 4 days, 2 days a week. I got to be honest, 2 days a week. So I really enjoy it. And I will tell you this. I did this presentation for the ladies PGA. This was a number of years ago when the ladies PGA was coming through Pittsburgh, and they wanted me to put together a presentation for them on what to eat healthily. So at the tail end, if we have enough time, we're going to go into how do you eat properly to golf properly. And I think that's a really cool idea too. So
I don't think people put as much emphasis on like conditioning for golf as they do other sports, but that doesn't mean it's a correct philosophy.
Right.
And eventually people that are talented, right, like that are naturally athletically talented, eventually that's not enough. So this is going to be good. I'm excited.
Yeah. And let me just start out by just saying one thing. The new topical CBD that Nutritional Frontiers has should be in every single golf bag. I have shared that with others that have, 5 holes into this. Oh my God, my wrist hurts. This hurts. Here, put some of this on, and all of a sudden everything gets better. So it needs to be in your bag. It will withhold even in the heat. It'll stay safe with your golf clubs. You need a bottle of that in your pouches on your golf bag every day you go out. Okay, that's my opening.
All right, that's it, huh?
Let's do it.
Well, honestly, I always say that should be in everybody's bag, period. So
exactly.
All right, let's go.
All right, staying healthy on and off the green. So we're going to use some of the principles that I put into this presentation that went to the LPGA. This is the ladies who are doing amazingly well now. So how do you incorporate these healthy habits into your golf game? Now you're going to say, well, wait, I don't golf. But I'm sure you know somebody who does. It's the #1 place for business transactions in the United States right now. So it becomes more and more popular. It becomes you against the golf ball. And just, let me just say the non-political statement from the beginning. Out of every sport that's out there, you don't see golfers kneeling. You don't see golfers causing any controversy. You don't see golfers doing much bad at all. And the PGA donates more money to charity than the NFL, Major League Baseball, and soccer combined. So as far as an organization that has their act together, it needs to be something that you become familiar with. This is a picture that was taken of me years ago. I wish I could still say I look like that, but let's go to the next slide.
Wait a
This one's
second, that's
intriguing.
you? That's awesome.
You bring up the next slide.
Yep.
A long time ago. That's down at Kiowa Island. And yeah, back when I had hair and everything else. Come on, don't make a big leading cause of disability among persons aged, what, 65 and older, 55, 70, no, 15 and older. The leading cause of disability is not spinal injuries. It's not a stroke, if you see at the very bottom. It's not diabetes. A lot of the things that we as Americans spend time on supporting, which is great. Heart trouble, lung, respiratory. You want to add COVID into there under lung respiratory? Sure, you can add that in. But arthritis and rheumatic disease tops the list of disability among all of us here in the United States. So we got to put this to the top of the list. What we're going to talk about today is extremely important. Here's the outline on the next slide. We're going to take a closer look at joint health and arthritis. We're going to look at, and I'm not going to bore you with biochemical mechanisms, but you need to understand that as God created our bodies, God built us to move. Okay? God built us to move. We're going to look at the current medical treatments, what's still being prescribed today. We're going to look at osteo versus rheumatoid arthritis. Really, really important from a dietary standpoint, from my clinical nutrition. Why is diet important, not only for golf, but in the prevention of any kind of joint issues? I came up with a 30 list and give you some ideas how you can use this 30 list as a checklist and how you can assess your own symptoms and risks as you get involved in that. Here's a little bit more in the outline. We're going to look at natural therapies at work. Nutritional Frontiers has spent decades, and I have to say decades, coming up with the right forms. Yes, CBD is one of those. X-Flame is one of those. HA Plus is one of those. There's a whole myriad of different formulas that are amazingly supportive to joint health. We're going to look in part 2, if we have time today, healthy eating for your golf game, the importance of warming up. Stretches, we're going to give you just a little bit of stretches pre and post round. Post round, when you're done golfing, you need to do a specific set of stretches so that you don't cramp overnight. Believe it or not, in golf, you use more muscle groups than gymnasts do. Think about that for a minute. The importance of massage therapy and even some social media resources that are out there that can help you if you want to really dig into this thing in a big way. Let's take a look at the normal joint. We're going to look at the joint capsule. I don't know if you ever heard that term before. We're going to look at articular cartilage, synovial membrane. What's the role of cartilage? What are chondrocytes? And then the inevitability. You know, if you read the book of Genesis, you realize that Adam would have lived forever. You know, there was no death introduced into this world until that first sin. So we have a limitation. We have a limitation to the number of years that we have here on the earth. And only God knows those. But what happens to our joints as we age? There are changes that take place. Most of them, I will say, evolve around changes in digestion. So don't forget that. Okay, next slide. Here's a joint. You know, and I want you to look at something here, is the entire capsule, which is a coating over the entire joint space. Look where cartilage is. And I want you to pay very close attention that there is a joint cavity, a space, that's very small and has a very limited blood supply. And you've got this synovial membrane that covers it, and you've got that cartilage inside of there. Why is it when you look at the proper forms of a joint support, you may go to the big box stores and buy some joint support prep that's glucosamine and chondroitin, all of which is good. But when it comes down to getting something into that joint cavity so that that space stays together, let me just say this. There is really no such thing, you may have even heard it from your doctor, as bone on bone. Just doesn't happen. There's always some space there. And the space will shrink as we age. But it's very, very important to realize in order to get good support for that joint cavity, it has to be coming from a very, very small molecular weight. That means that the molecular size of what you're taking in that supplement has to be so small that it can be absorbed through the gut into the bloodstream and make it to a spot like this that has very limited blood supply. Now, remember that synovial membrane, and you see where the cartilage is. This is why it's so important that cartilage tends to degrade as we get older. It gets dried out, sort of like a rubber band that gets dried out. So it's very important when you look at hyaluronic acid preps like HA+, about how that enhances cartilage flexibility. So it's much more than just getting something jammed into that joint cavity, reducing the inflammation and allowing the blood supply to that joint to get in there in the best and most efficient way. Next slide. Normal joint. This is what most doctors do. You go to your orthopod or you go to your PCP. They're going to give you systematic temporary relief. You're going to say, my joints hurt. They may do an x-ray. They'll take a look and say, yeah, you have bone on bone, which you really don't. And they may say, yeah, you're loaded with arthritis, and we're going to take a look at arthritis in a little bit. But what are they going to do for you? The newest approach, if you fail all of the oral preps, is to put you on something called a biologic. But typically, we start out saying, let's go in with an NSAID, a non-steroidal anti-inflammatory drug, naproxen, ibuprofen, and realize something, folks, that those give you temporary relief. But as you go back to that last slide and you looked at that cartilage area, the longer we're on ibuprofen, naproxen, any of these non-steroidals, is that they actually will expedite the drying out of that cartilage tissue. Temporary relief, long-term degradation. Neutralizing inflammatory factors, looking at things like piroxicam, Celebrex, these COX-2 inhibitors, and then the newer ones that you're seeing advertised all the time, which are most times injectable, or they have the one called the injection, or I think it's called the injection, Xeljanz. You know, these are biologics that have a whole myriad of different side effects that will go in and reduce your body's self-attack to that area. But when you're looking at this type of basic arthritis, those biologics aren't much good. Next slide. A little bit more on biochemical mechanisms. Inflammation, folks, and I think we all know this, is a living tissue response. When we get inflammation and the body is trying to send a signal to us that something is wrong, the joint is feeling it. I feel it in my elbow. I feel it in my knees. I feel it in my ankles. Mechanical, chemical, and immunological challenges. There's a mechanical change that takes place. There's a chemical change that takes place. And your own body's attempt to calm this thing down and get rid of the inflammation can be a factor as well. So inflammation equals high levels of arachidonic acid. You can actually document that in blood streams. When the inflammation is high, arachidonic acid is high. Now, let me just say this. If you're dealing with joint issues, first thing that you need to do is stop anything from a cow. No dairy, no red meat. Highest sources of arachidonic acid. So if you want to get some joint relief, or if you have a patient that needs some joint relief right off the bat, pull these things away dietarily. Pull them away and watch. Just say, give me 7, 14, 21 days off of these particular foods, and you'll see a big difference in the inflammation levels coming down. Next slide. A little bit more on biochemistry. There is a thing called the arachidonic acid pathways, and inside of there you'll see something called cyclo and lipooxygenase pathways, which lead to prostaglandins and leukotrienes. Bored to tears, I'm sure you are. So again, these are the most important mediators of inflammation. This is where the fellas in the labs really spend their time. If we understand that these cyclooxygenase pathways are something that if we could go in and block them, we go somewhere. We can make a difference. If we can inhibit these leukotrienes from being formed, we can start to reduce inflammation. So again, most of us don't need to know this, but understand that when they're in the chemistry labs, when they're looking at factors like this, This is what they're using to design not only pharmaceuticals, but also the well-done nutraceuticals that have a track record of working. In this particular case, if you want to look at it, one entity that has now had a huge track record of interfering with all of these pathways to reduce inflammation, you could look at CBD. And when you look at the highest quality organic CBD, fully distilled, purified, in the right forms, you can make an amazing change in joint health. It gets to be an adjunct. It's going to reduce the inflammation. You do that in a combination, and we'll talk about that at the end. You can make a huge difference in your joints. And let me just say this. When all of this is in place, I've had a lot of people that said, no, wait a minute, I have a 16-year-old that's playing baseball that every now and then complains that his knees are hurting. I have a 21-year-old that's playing college football. Start them on joint support at an early age. It is going to be extremely important to keep those joint spaces healthy, vibrant, and strong. You want your child to be safe, avoid injury, do well in their sports, in their sport field, support their joints. Don't think that they're too young to start a level of joint support. Check in with somebody. Tracy's a good place to start. Check in with Tracy, check in with Michelle, give me a call, and we can put together a protocol for you using the right mediators at the right dose. Next slide, please. Arthritis now. Generalized arthritis affects over 49% of our general population actively. That includes every infant, every baby, every person out of the 330 million in this country. That means that over 160 million people have some level of active arthritis. It's estimated that it affects almost 80% of us at some point in our life. That means there's only 20% of us that can walk through life and not really have any problems. It's the most common cause of MD visits. Did you know that? There's more money spent in the healthcare field for joint problems than anything else. I understand that doesn't, wait, that cannot sound right. Yeah, it is. That's where the bulk of the problems are. They're mechanical problems that we all encounter, and then we run to the doctor to get one of those non-steroidals or a COX-2 inhibitor like Celebrex, or we get our knees injected. One of those. It affects the golf game more than any other factor, including ability. When you look at a couple of the golfers that were in the top 5 going into the final day that actually ended up with a joint problem and had a withdrawal. You know, these golfers spend their entire careers getting themselves ready for this. They train unbelievably long hours. And then if something would happen to their joints, Phil Mickelson's another one that really just won a big tournament this year at age 52 that suffers from rheumatoid arthritis. He actually does commercials for some of the Enbrels, I believe. So understand, this affects the golf game more than any other factor. Next slide, please. Osteoarthritis. Let's go to the basic. Does not cause redness, warmth, or inflammation of the joints. This is the typical bone arthritis, the typical most common form of arthritis. Keep in mind, these are just some of the factors if you want to determine what level of inflammation, what level of arthritis you may have. It initially starts on just one side of the body. It's typically if you're right-handed, it's typically going to start somewhere on your right side. Does not cause a feeling of sickness. A lot of times when you have rheumatoid arthritis and your immune system's off, you just don't feel well at all. Osteoarthritis, again, develops slowly over many years, and it typically comes after an injury, something that happens that really antagonized a joint space, and then we start to fill it up with arthritis as we go. Next slide. I have my slides out of order. Okay, there it is. This is, again, obviously a hand, but I want you to just look at the tip. A couple of the words that are extremely important. When you look at this is a drawing of a hand with the middle finger. Osteophytes, looking at the inflammation. And if you look at the finger on the left, the finger on the right, compared to the one in the middle, you'll see a swelling of that area where there's been an attack going on to that particular joint space. Joint space then becomes narrowed, that's step 2. And then we see the urination of the subchondral bone. We start to get a degradation of that bone in that bone space. So this is a lot of us that feel this in our hands oftentimes, the tips of our fingers, where we start getting pain there. It's a very common spot. It's the furthest area for blood circulation, and it oftentimes will show itself in that particular area of the finger. Next slide. Here's an interesting one. You know, as I said, we don't see bone on bone very often, but this is actually a copy of my x-rays prior to me having a knee replacement. Now, unfortunately, I destroyed my knees playing football many years ago. And one of my dear friends, a chiropractor, John Giovanelli, friend of mine in Atlanta, one day I was playing golf and he says, you know, you're becoming bow-legged. And I hadn't realized that my knees were actually collapsing onto each other. So it ended up to the point where it could not be salvaged anymore. But again, this is a very common when the degradation gets so intense that you have no choice, that something has to go mechanically to be changed. And again, this part of this discussion is to prevent that from happening. I thought I was doing that. I did everything that I possibly could. But the intriguing thing is when they do these x-rays, there was very little arthritis in my joint spaces. Mechanically, the joint was shot, but there was no real big problem with arthritis because I had been taking care of my joints for years. It's just I hurt them very badly years ago. Next slide. So again, osteoarthritis, the wear and tear arthritis found in any joint, knee, hip, elbow, shoulder, etc. It's a loss of articular cartilage. Go back to that picture of the finger. You saw the articular cartilage start to just basically wear out. Typically, it happens after some trauma. We end up with some swelling and a grinding feeling. A lot of us get that even in our necks when our cervical spine starts to have difficulties and you're going left and right. You can actually hear the grinding sound. Again, typically a sign of arthritis starting. Next slide. This is another really good picture of a hip joint, ball of the femur into the socket of the pelvis. Okay, and what we're going to look at here is one of the most common surgical procedures right now for those of us in our later years is to have a hip replacement. Why? Because of the basic weight that ball of the femur must hold, supporting all the weight of the upper body. Okay, this is an artist's drawing of a normal hip. Now the next slide is going to show you an arthritic hip. So just keep in mind of that and see where the arthritis shows up. Right where the cartilage gets damaged, right where the wear and tear gets damaged. But look what it's doing. Again, artist conception, looking at the arthritis starting to go into that joint space. You got much less flexibility. You're going to start getting the nerve involvement, and you're starting to see the bone degrade in the hip, to the pelvis. And again, these are part of the problems that eventually lead to the need for a joint replacement. Next slide. Now we're going to talk about rheumatoid arthritis. This is the autoimmune, redness, warmth, and swelling of the joints versus the osteoarthritis, which really didn't have that. It affects the same joint on both sides of the body. Remember what I said about typically osteoarthritis tries to stay on one side of the body. Not always, but it tries to. Rheumatoid arthritis, you're going to see the same thing. My right elbow, my left elbow, simultaneously. You get this feeling of sickness, fatigue, may even lose some weight, and a fever that goes continually because you've got a self-attack going on by your own immune system. May develop suddenly, may just go all of a sudden be tripped. And believe it or not, ages 25 to 50 is where this starts. So you don't see rheumatoid arthritis being a disease of those over 60. This typically starts at a very early age. And as we've gotten more and more desk involvement, more and more people just sitting down at a desk and not moving as God created us, you're starting to see more and more of these conditions come. There is at least some genetic involvement in here where there's been issues that we got in the gene pool from mom and dad, I'm going to say this. The most common thing that I've seen about the starts of rheumatoid arthritis starts in the gut. If we have histories, we're back in the 20s and we're living on Prilosec and we're living on Nexium and we've had all sorts of ulcerative colitis and irritable bowel syndrome, those are some of the conditions that can lead to the development of rheumatoid arthritis. Always look at the gut first. Look at preps like GI Complete to really keep the gut in line. Next slide. Traditional treatment, non-steroidal anti-inflammatories, ibuprofen, naproxen, COX-2 inhibitors like piroxicam and Celebrex, both which come with a whole boatload of different problems. And lastly, suppression of the destructive cytokines, Enbrel. There's 5 or 6 new ones that have just, Xeljanz, all of these new ones that have just come out. They're biologics. And when you do put a big suppression on your own immune system, you run into a whole world of potential problems. Next slide. Some of the warning signs: pain in one or more joints, inability to move. You know, you basically have frozen that joint space. It is swelled to the point where it's inhibiting the movement of it. Again, it's that point or even earlier, you need to seek counsel about trying to do something to get that joint back into space. And believe me, I am a firm believer in chiropractic care. A good chiropractor that can do x-ray and can take a look at that joint space and help you to instill the mobility back into those joint spaces are critical. Critical. Massage therapy, critical. Even things like acupuncture, all of which can be helpful in the early stages. Next slide. So when conventional drugs are not enough, or we decide I don't want to go the conventional spots again, where do you start? High quality, distilled, non-pelagic fish oils, EPA, DHA combination. One of the things I liked about Nutritional Frontiers is that they do the distillation properly, they do the packaging properly, and they give you the high levels of EPA and DHA along with vitamin D as well. Extremely important to get it in that form. Proteolytic enzymes. This is an old cure, been around for decades. Using proteolytic enzymes, which are enzymes that actually are taken sort of like digestive enzymes that can go in and, for lack of a better term, play like Pac-Man and sort of help to degrade some of that inflammation that may be starting in the joints. Vitamin K, oftentimes feared by medicine. Super K2 Plus is one of those that I use a lot with people with joint issues. Why? I got to get that blood supply to the joint. I need help getting that blood supply to the joint. I need help getting the circulation to move. Now, you can look at preps like CircuCore. Yeah, they're going to help. But vitamin K, Super K2 Plus, which you need to use under the auspices of your healthcare worker, extremely important, can help to make the blood less sticky so that we can get movement of blood into those spaces. Curcumin, turmeric, probably the most powerful natural entity. Again, as a spice, adding it to your food, and also as a supplement. Undenatured type 2 collagen. Again, these go back to the bone broth concept that says I can pull these undenatured, which is 2 negatives, of type 2 collagen. There's type 1, type 2, and type 3. Type 2 is a really specific way of pulling this out of the breastbone of chicken, typically is the best source, taking it orally, and can actually confuse your immune system. So if we have rheumatoid arthritis or some autoimmune attack going on, by taking undenatured type 2 collagen, the body looks at that as being very similar in structure to the joint space. So in the gut again, we can start an attack to diffuse our own immune system to go after the undenatured type 2 collagen rather than go after our joint. I've used that concept a lot with rheumatoid arthritic patients, and it works well. Topical preps, the topical CBD, bar none, is one that's going to go in there and really help to get the inflammation down in the joint spaces as best you can. And don't forget, coming from my pharmacy side, there's a whole world of compounds that can be done out there. where you can actually have specific entities compounded that can be helpful for the joint space. Next slide. So when we look at diet and inflammation, I've been a biggie back with Jamie 25, 26 years ago, since I've known Jamie from Nutritional Frontiers, back when he was with Metagenics, came up with a list of foods called the anti-inflammatory food list that says, let's try to keep this really basic. I'm not looking at these things from fats, protein, carbs. I'm not looking at it from caloric intake. I'm saying, can we see which foods have a potential to raise inflammation? And when we looked at the list of all the foods that were out there, what topped the list was corn. Corn became an inflammatory food. A cow, both milk and red meat, very strongly involved there. And this slide says a reduction in the intake of omega-6 fatty acids, the more inflammatory side. Meats. Now, we don't include poultry in this. That seems to be okay. But meat and egg yolks really have to be watched. Increasing omega-3 foods, such as salmon and other fish, and reduction of high glycemic index foods. We find that if we force the body to use more insulin than it actually needs to get the job done, when we do insulin levels and blood work, typically, if our blood sugars are staying in the 80s and 90s, fasting insulin should stay in the 5 to 7 range. When we start seeing insulin levels 10, 14, 20, 21, 22, not only is that a pre-diabetic situation, that's also that insulin can be pushing inflammation as well. Next slide gives us some foods to avoid. Fatty cuts of red meat, hot dogs. It was amazing yesterday. We were playing golf and we got 9 holes in yesterday. I was going with my neighbors and we came in at the turn and it was just amazing. Like a whole myriad of people walking into the snack shop, walking out with a hot dog, walking in, coming out with a hot dog. And I said, I don't think so. And they said, what's wrong? It's meat, isn't it? And I said, yep. And the joke has always been, it even contains lips. So I just don't do hot dogs. I'm sorry, you can't. Organ meats, which is, again, probably the major component of what's in most hot dogs. Chips and pretzels. Now, again, getting back to hot dogs, let me give a thumbs up to Aldi's, is that they've got 100% turkey hot dog, which is nitrite-free and uncured. So, again, you want something that, in my opinion, you grill it, it tastes just like a hot dog, but it's coming from a very clean source. It can be done. Chips and pretzels, again, the most common foods that you see out on the golf course. Pasta, simple grains, juices, especially orange. Orange juice came in as one of the top foods for inflammation in the joint space. So if you start every day out with orange juice, maybe switching to grape juice or cranberry juice might be a better way to go, at least initially. Rice, plain white rice, even though the black rices and the full grain rices are okay. And then simple white bread. Notice I didn't call it gluten, even though gluten is a big deal here. But simple white bread, and again, the sensitivity of wheat here is huge. Next slide. Foods to add. Now this is my label on top of best whey protein. And I got to say this, there are a world of proteins out there, a world of them. The best whey protein by Nutritional Frontiers, I will guarantee you that you can't find another product. If you go to GNC, any of these places, and buy 100 different proteins in powdered form, you're not going to find one that tastes better. Period. Because when you put these things together in the clean form of whey protein, and you use the correct way to make it taste, the right forms of cocoa, the right forms of vanilla. So we put them in not for a glycemic load, but really to make it a tolerable, good tasting treat. Quite honestly, it's important. So foods to add: salmon, other fish, oatmeal, fresh fruits and veggies, olives, olive oil, nuts and seeds, and whey protein. I'm going to save a little time at the end because I want to bring Tracy on at the very end to talk about when she came down here to visit, her and Michelle. We went out to a Mediterranean restaurant And we just want to reiterate what we had to eat that day and how well this place put it together. The next slide. More natural therapies. This is, again, my label on top of HA+, my label on top of the fish oil. Some of the other things that can be used: nettle leaf extract, SAMe, nexrutin, which is a philodendron extract, glucosamine sulfate, chondroitin sulfate, white willow bark, which is where aspirin came from initially, and fish oil, your omega-3s, all of which can make an amazing change in the content of the joint and taking down some of the inflammation. Next slide. Let's not forget antioxidants. Your basic multivitamin, reducing oxidation in the body. MSM, gamma linoleic acid, GLA, copper, curcumin, turmeric, water. Water. Let me say this again. Water has to become a food group for us. Yes, protein. Yes, fats. Yes, carbs. Yes, fiber is a food group, but also water. You need to hydrate for joint spaces to stay healthy. Next slide. So how do you assess your risk? Here's some of the most common. Are you 45 or older? Have you had an injury that keeps you in bed? Obviously, to use a cane or a crutch. Are you more than 10 pounds overweight? There's one that gets a lot of people. Have you participated in greater than 3 hours of heavy activity, lifting, etc.? You had hip problems that caused you to limp. That's an amazing one, because that is one of the reasons we've had so many people need a hip replacement, is it waits until the end, until that hip basically degrades or locks to a point where it has to be done. Next slide. Has your doctor told you you have arthritis? Hopefully, as he did x-rays, he can look at those, or the radiologist can, and assess the fact that, yes, you do have arthritis in those joints. Have you had pain in the joints over the last 12 months? Problems during 50% of your day? You may be sitting at a desk, but when you stand up after you've been sitting there for 2 or 3 hours, what happens? You have pain in the knees when just walking 2 to 3 blocks? One of the most overlooked is hand pain. You know, unfortunately, that's one that I have to struggle with. And I get it right in my thumbs because I think I grip the club too strong. Do you have limited in your activity? You cannot dress yourself? You ever get to the point where you can't seem to get the button to go through the hole? Can't stand up from an armless chair? There's a good one. Sitting down with a chair that doesn't have arms to push, that you can push up on. Can't get out of your car? Do you struggle to get in and out of your car? Do you have trouble opening your car's door? Just some of the telltale signs that you may be having a problem. Now, next we're going to go into my 30 joint health tips. And I will print some of these out and make them available. If you want to call our office, I can get these to you. Here's 30 tips to help you with your joints. Resolve to reduce. Try to get some of your weight off if you're carrying extra weight. Turn off the tube. Turn off the tube. Limit your TV time to less than 2 hours a day. Start to build strong bones. This gets into that Super K2 Plus. You know, I'm not talking calcium here. I'm talking about Super K2 Plus and vitamin D. Build strong bones. Stop going through any drive-through. You want joint health, stop going through the drive-throughs. Period. If you're going to go to fast food, yes, I know that they have some choices there that you can get that are okay. Park your car, get out, and walk in. Now that COVID's over, you can go back in. Pick, pour, or peel. Fruits, veggies. Add color to your diet. Eat the rainbow. We talk about that all the time, about those red hues. You want to start adding something to your diet? I use red sweet peppers, and I add them to every single salad that we make. Orange ones, yellow ones. Get the rainbow. Put them in there. Hang out at the bar. Again, if you're going to a restaurant that does have a salad bar that's decent, it's a place where you can go and make a big change in your diet. Fill up with us. But I always like to say one thing. Get a healthy meal. Have the salad as dessert. Put the fiber in at the end of the meal. You get the advantages of the fiber a little bit more that way. Next slide. Throw some fish on the grill. Sometimes not easy to do, but grilled fish is a phenomenal way to cook. You can buy those new, I think some of the new adjuncts you can lay on the grill so you can actually not have the fish crumble and fall apart. Keep a food journal. You know, if you're going to talk with somebody like Tracy or Michelle or myself or whoever your practitioner is, you should have a food journal there so that we can take a look at that and point out some of the things that may not be going quite right in your food. Break it up. Graze. Take the time to say, I don't eat 3 big meals a day. Maybe it's going to be better to eat 6 smaller meals a day. Watch your caffeine intake. Take your vitamins. Take the plunge. You know, it's been said over and over again about the value of swimming. You know, I love it when Tracy posts on Facebook with her family how much time they spend in the pool. It's fabulous. It's a great exercise. Let your kids blow off some steam. Let them work those joints. Swimming is a phenomenal way to get the joints moving. Take a hike. You know, when we look at taking a nice, slow, steady 3, 4, 5 mile little walk, get some hills involved in there, can do an amazing help to get your joints in the space that it needs to. Next slide. Warm up. Don't just go out and say, I'm going to go for a hike. Warm your joints up a little bit. Go for function, not fashion. You know, we don't have to go out and get the highest quality gear for walking around. Make sure you stretch first. If you need to get a brace on that joint, get a trainer if you can afford that, or see a chiropractor for some tips on good joint health. Avoid a pain in the neck. Most times we don't think of our cervical spine as a joint, and we tend to overdo the joint spaces. We have a bad pillow. You know, I got to see Mike Lindell a couple weeks ago about MyPillow. Is it time to get a MyPillow just to help with your neck? And ditch the high heels, ladies. It's amazing that, you know, and I know my wife's downstairs talking with somebody else right now, but for her whole career, she was renowned in her work for wearing the highest heels. She's short. She's only 4'11", 4'10", and she would wear these extremely high heels. And now that she's retired, she's dealing with some of the arthritic problems. Looked great. It was a fashion statement, but it really caused a problem. Next slide. Sit and stand. If you're sitting at your desk, spend some time. Stand. Get to sit, stand, sit. Handle heavy loads very carefully. Watch how you lift. Do the right thing. You ever hear of cursive writing instead of typing? Enjoy a massage. It can really, really help get the blood supply going. Sit, soak, and soothe. And again, a good magnesium-rich bath, adding Epsom salts and baking soda to the bath water and soaking it out. Pack some heat if you need to, and chill out. Which is the best way to go? Is it hot or is it cold? It's going to vary from person to person. I like to use some heat followed by some chilled. So again, I think that's a little bit more. We have about 4 more on the list. Next slide. Rub out the pain. Make a date with your doctor if it's gotten that bad. Fess up about what you may be doing that causes the problem. Then resolve to kick butt. What I mean by that is some of the kicking motions that we can go through. If your problem is with your knee and your ankle and your hip, there are slight kicks that can be done that can really make a difference in keeping that joint space. Next slide. You're going to hear more about this coming up soon. Next rutin, which is philodendron. It's a plant source anti-inflammatory. It's a natural COX-2 inhibitor. Has no COX-1 inhibition. When you look at drugs like Celebrex, Piroxicam, there's a whole myriad of those. They ended up causing a whole world of problems. COX-1, if you inhibit that, will affect the liver, will affect the kidneys, will affect the heart, will affect your platelet aggregation, and will affect your stomach lining. So when you look at these supposed drugs that were put on the market, which were going to be safe to take for your stomach, we run into the world of hurt that goes with us. And don't forget CBD. The right forms of CBD at the right dose can make an amazing change. Next slide says take a break. We're going to go past this. That is my phone number on it. If you want to call my office, set up a time, be glad to work with you. We can do this remotely with Zoom or whatever way that we can. My office is located in Fayetteville, Georgia, Peachtree City, and we could easily communicate just like we're doing right now. Let's try, we got a few minutes left. Let's try to go into the next slides just a little bit, Trace. Healthy eating, is it possible for a golfer? Next slide. For those of you that are golfers, you're going to recognize this bridge. I love the Masters. But this isn't the Masters. This is actually a course that was built to mimic the Masters. But I had a chance to play it in this hole, which I think was number 13 on the Masters, which was this world famous bridge. I didn't take this picture, but that's me standing on the bridge. And the next one is a picture of me after I went to hit my first golf shot. And if you look down there, there's a stream, and you'll see a ball way down there right next to the wall. Yeah, that's a terrible shot. But that's at the point where I wasn't a very good golfer. I'm not saying that I am now. Next slide. Diet for the golfer. Good diet equals good play. Good diet equals good play. Let me say that a third time. Good diet equals good play. Before the day begins, low glycemic meal, lentils, legumes, apples, pasta, nuts, easily digested food. Make sure you're hydrating properly in the course. You see the pros do this incessantly. Drinking water, having some mineral waters are extremely important. Limit or eliminate alcohol. I know that becomes a staple for a lot of people on the golf course. Have a beer, bring some liquor with you. Try chicken for a change. You know, there are chicken sandwiches that they can make you at the turn if you call, and stay away from the fatty foods. They're all good tips to keep yourself as a better golfer. Next slide. Golf is less intensive physically, but more intensive mentally than rugby. So the nutritional requirements are completely different. A golfer is expected to have muscular and mental endurance and need to concentrate for up to 5 hours at a time. One of the reasons that fish oil is such a critical part of this, it's you against the ball. It's not a team sport. It's you against the ball. It's you playing one-on-one. Muscular posture has to be consistent. This is where I will pull in, again, working with a chiropractor. Make an appointment with your chiropractor and say, look, can you look at me structurally as a golfer? Let him watch you take a swing. Let him help you get your joints in alignment and your muscular posture where it needs to be. And an anti-inflammatory diet is a critical part of this issue. Next slide. The most common golf food. Yeah, we had there's some vegetables on there, right? You got onions. It is unfortunately quick and easy, and the golf courses love to jam them down your throat. But again, stay far, far away. Next slide. Healthy eating. What's the definition of healthy eating? Balanced. It varies from person to person, which is why we want to do a basic food journal so we can give you the parameters. And understand, if you want to do, and again, we're talking here about golfing or any physical activity, no excuses. There's no excuses to not eat properly or not stretch or do the right things. And coming up with a plan and implement. We are what we consume. Consume good food, consume anti-inflammatory food, inflammation goes down. That's called healthy eating, and it can make a big, big change in your golf game. Next slide. Don't tell me to improve my diet. I did carrot once and nothing happened. Next slide. I must be eating right. I'm narrow on the top and wide at the bottom, just like the food pyramid. And you know, it's amazing. Golfing yesterday is watching how many people are actually built like this guy. And then they struggle. They can't take a full swing. Next slide. Some facts. Healthy claims fool diners into eating extra. It's a trick of deception. Most foods that claim to be healthy, most and not all, have some claims in there that just try to fool you into getting into some of these, especially some of the frozen meals. The USDA food pyramid is built on shaky scientific ground. It's distorted by the department's mission to promote agriculture. It tries to get you to eat more grains, more things like, oh, let me turn my phone off. More things like wheat. Low glycemic index breakfast control your kids' calories. Watch that. And again, if you need help coming up with some ideas for a low glycemic index, talking to somebody like Tracy or Michelle or myself can give you some of the links that are necessary to give you the right foods for your kids. Next slide. Some of us are really addicted to food. There's no doubt. Put your hand up. Do you eat because you're hungry? Do you eat because it's time to eat? And understanding the role of leptin and ghrelin and how important leptin and ghrelin is as the feedback mechanism to tell you you're hungry or you're full in the digestive process. Why cake and not broccoli? You realize that prior to 1930, birthdays were celebrated by making a broccoli dish and putting candles on it. I didn't know that. And somewhere along the line, we put a cake in there. So again, go back to the ideas of eating fruits, eating vegetables at the right time continually. Next slide. Again, I had mentioned this earlier. What are we consuming? Water, protein, fats, carbs, fiber. When you do an assessment of your diet, when we look at your food journal, we're going to look at it. We're looking at getting somewhere between 40 and 50% of your diet from protein, about 30% or less from carbs, about 10 to 20% from good fats. And then we're going to do the fiber as a secondary measurement within there. And then we're looking at sipping water all day, having water available so that you can sip it as you go through your day. Next slide. Protein, we're going to go through these quickly, Trace, because we're coming to the end. Protein, large organic compounds. Next slide. Just some chemical structures of protein, just to show you with an artist's conception from organic chemistry about how big the molecule of protein is. Next slide. Steak. That's what we think about when we talk about protein, don't we? Next slide. Fats. Solid or liquid at room temperature and soluble in water. The triesters of glycerol and fatty acids, double bonds. There are good fats. There's all kinds of different saturation levels, monounsaturated, saturated fats, the good versus the bad, all which can be measured in blood work right now. Next slide. Notice this is the three-dimensional structure as compared to what you saw with protein. Those red dots there are showing you where the double bonds are occurring in this. Those double bonds, when they're digested, break and give off energy. Next slide. Carbohydrates, simple organic compounds. Let's go ahead. This is the most common food that we eat. Next slide. And again, this is straight lines. Where the other ones are three-dimensional, carbohydrates are typically the straight lines that go straight out. Next slide. We're going to go through these quickly. The top 5 best foods. Let's bring those up. Number 1 is garlic. Assists the bacteria in the gut, benefits with cancer, relaxes the arteries, assists cholesterol. Add with your salad dressing, great for cooking. That's number 1. Number 2, next slide. Nuts and seeds. Great source of healthy oils, enzyme rich, should be eaten raw. Next slide. Olive oil, made the 3rd position, rich in polyphenols. And again, Greek versus Italian. There's no such thing as Italian olive oil. They don't make olive oil in Italy anymore. The majority of good olive oil is coming from Greece. Watch that you don't get one that's made in Morocco. That's, again, a very common, some of the most health brands. Keep in mind, every label has the country of origin on it. You never want to blended olive oil. California is a great source right now where you can get some olive oil from there. Number 4, tomatoes. Change the way your arteries age. Potent antioxidant. Next slide. Spinach. There's your top 5. Sounds like a salad, doesn't it? Macular degeneration, rich in carotenoids, ultra nutrition, great cooked or great raw. Now let's go into the bads. Top worst foods for you. Saturated fats, I'm sorry. mostly animal-based, solid at room temperature, lard-like, used in furniture polish. Will destroy your arteries. Next. Simple refined carbs, you're looking at flour, poor nutritional value, stripped bare. If it has kernels, it has some vitamins. So that's when we look at the whole grains. Hydrogenated oils to increase shelf life, turns the oil solid. We're going to get Crisco and things like that. Next slide. Simple white sugar. Energy surge followed by drops, raises your insulin levels, gets to be a problem. Number 5. High fructose corn syrup, number 1 crop in the United States. Again, it's everywhere. I think we're out of time. Whole grain next. Let's go to the next slide. I just want to go finish up with one thing on the fats. There he is. Just look at that really quick. If you look at that and go to olive oil and you see the yellow line, that's what you're looking at, which is the mono unsaturated. And you see that olive oil tops the list. Canola oil up there in second. You're looking at things down below. But again, if you look at the very bottom, those of you that really like to consume a lot of coconut oil, notice it's very high in saturated fat. It's the highest. So again, using balance when you make your choices is what it's all about. All right, hopefully you got a lot of good information out of there. Tracy, can you just give us just your 2-minute assessment of that dinner we had at that Mediterranean restaurant?
Oh, it was fabulous. It was completely fresh, you know, and healthy. It was based on the Mediterranean diet. So I loved it. It was great to have a little glass of wine and, food that was real and organic. It was delicious.
That little table that they spun around that had little pieces of fresh cheese and some nuts and some olives and a little bit of hummus and little things to dip. And it was like that was an appetizer. Instead of getting, let's see, cheese sticks, that was an easy way to eat healthy. We all enjoyed it. It was wonderful. So it can be done.
The charcuterie board, that was really good. So yeah, really good stuff. So, and we appreciated the company more than anything. So
well, and I appreciated you coming down. It was fun to have you. So
yeah, this was a great
lot
presentation.
Of information there that would help somebody with their joint health, and go back and listen to it again if you need to. All
right. Well, thank you, Dr. Len, for being here. Let people know how to get in touch with you if you can.
Phone number to my office is 678-228-8900. Our website is the Nutrition Shop, SHOPPE.net, thenutritionshop.net.
All right. Sounds good. Day. That's in the chat. Thanks, guys. And thanks for being here, Dr. Len.
Thank you, Trace. Good talking to you.
You too. All right, everybody, stay tuned because Jason Sloan is up next, and he's going to be talking to us about ozone, absorption therapy, how to use God's greatest gift, ozone, and plant-based nutrition to bypass poor gut health and have a great healing success. I love ozone. I love all of his products. So stay tuned. You're not going to want to miss this.